Good morning, everyone. Thank you for being here today. I'm excited to introduce our presentation on promoting safety in the healthcare environment. Today, we'll explore key strategies to ensure safety for both patients and staff. We'll cover best practices, safety protocols, and ways to foster a safety-first culture. Let's get started. Today, we're going to focus on understanding the importance of safety in healthcare environments. Ensuring safety isn't just about protocols. It's about creating a secure space where patients can heal and staff can work confidently. We'll also look at the physical environmental factors that can impact patient safety, things like lighting, clutter, or equipment placement, that we need to be mindful of. Recognizing and preventing physical hazards, such as fires and accidents, is crucial, and that includes knowing how to conduct fall risk assessments to identify patients who might be at higher risk. We'll talk about the vital role nurses play in maintaining a safe environment. Our vigilance, assessments, and proactive measures are key. Additionally, we'll cover safety devices and restraints, what types exist, their purposes, when they're indicated, and the legal considerations we need to keep in mind. All these points connect to our overall goal, creating a safe, supportive environment that promotes healing and respects patient rights. Let's talk about the importance of safety in healthcare. Ensuring patient well-being is at the heart of what we do, and safety measures help prevent injuries that could harm our patients. When we focus on safety, we also reduce healthcare-associated risks like falls, infections, and accidents, which can significantly impact patient recovery and overall outcomes. Promoting a safe environment fosters trust. Patients feel more confident when they see that safety is a top priority, which directly ties into providing high-quality care. It's also crucial to remember that maintaining safety isn't just good practice. It's a legal and ethical obligation for us as nurses. We have a responsibility to uphold safety standards because it protects our patients and reinforces our commitment to their health and dignity. Overall, prioritizing safety is fundamental to delivering effective, compassionate, and trustworthy care. When it comes to the physical environment, there are several key factors we need to pay attention to in order to ensure a safe and comfortable space. First, temperature is crucial. Maintaining it between 20 and 24 degrees Celsius helps keep everyone comfortable and prevents issues like hypothermia or heat stress. Next, humidity levels should be kept between 40 and 60%. This range helps prevent microbial growth, which can lead to infections, and also keeps the skin from becoming dry and irritated. Noise is another important factor. Minimizing noise helps reduce stress and prevent sleep disturbances, which are vital for recovery and overall well-being. Good ventilation is essential too. Ensuring there's adequate airflow not only keeps the environment fresh, but also reduces the risk of infections spreading. Proper lighting is also necessary, especially for care activities, so that staff can work effectively and patients can rest comfortably. Odor control shouldn't be overlooked. Regular cleaning and waste management are key to avoiding unpleasant smells that can affect both patients and staff. Lastly, pest control plays a significant role. Regular inspections and prompt elimination of rodents and insects help prevent disease transmission and maintain a hygienic environment. All these factors work together to create a safe, comfortable, and healing environment, central to the overall theme of quality care and safety. Let's talk about reducing physical hazards in the workplace. First, fire safety is crucial. Having clearly marked fire exits, accessible extinguishers, and reliable alarms are essential. But it's not just about equipment. Staff training on how to respond in case of fire makes a big difference. Next, we need to focus on accidents. Wet floors are a common hazard, so keeping floors dry and clean is important. Corridors should be free of clutter to prevent trips, and proper signage can alert everyone to potential dangers. Electrical hazards are another key area. Ensuring that all wiring is properly grounded and avoiding exposed wires helps prevent shocks and fires. Equipment safety is also vital. Regular maintenance and inspections ensure that equipment functions correctly and safely, minimizing risks. Finally, emergency preparedness ties everything together. Having clear evacuation plans, conducting mock drills, and educating staff on emergency procedures ensure everyone knows what to do when it matters most. By addressing these areas systematically, we create a safer environment that supports our overall safety goals. Let's talk about fall risk assessment. Falls are a common but preventable hazard we encounter in healthcare settings. It's so important to identify patients at risk early on to prevent injuries. There are specific assessment tools we use, such as the Morse Fall Scale and the Hendrich II Fall Risk Model, which help us evaluate a patient's fall risk accurately. Some key risk factors include age over 65, impaired mobility, certain medications, cognitive deficits, and vision problems. Recognizing these helps us tailor our interventions effectively. Speaking of interventions, there are practical steps we can implement. For example, using bed alarms and low beds can alert staff and reduce fall likelihood. Providing nonskid footwear helps improve safety when patients are walking. Ensuring adequate lighting and removing obstacles in the environment also play a crucial role. Additionally, regular patient rounding and monitoring are vital. They allow us to catch potential issues early and offer support before a fall happens. Overall, fall prevention is a teamwork effort, combining assessment tools, understanding risk factors, and applying targeted interventions to keep our patients safe. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. Now, let's talk about the nurse's role in providing a safe environment for our patients. First, it's essential to conduct regular risk assessments. This means constantly checking the environment for potential hazards and addressing them before they become issues. Next, ensuring cleanliness and hygiene of patient areas is crucial. A clean environment helps prevent infections and creates a safer space for recovery. We also need to educate patients and their families about safety precautions. When everyone understands what to do and what to watch out for, it significantly reduces the risk of accidents and complications. Monitoring equipment and environmental hazards is another key responsibility. This includes checking that all devices are functioning properly and that the surroundings are safe from things like spills or obstacles. Finally, collaboration with multidisciplinary teams is vital. Working together helps us implement effective safety protocols and ensures that safety is integrated into every aspect of patient care. All of these steps are interconnected and form the foundation of creating a safe environment, which is essential to achieving positive patient outcomes and maintaining trust in our care. Now, let's talk about some essential safety devices that help us prevent accidents and ensure patient safety. First, side rails are crucial because they help prevent falls when patients are in bed. They also assist patients in repositioning themselves safely. Next, grab bars are very important, especially in bathrooms and hallways, because they provide support and stability for patients moving around or getting in and out of the shower. We also rely on ambu or bed alarms, which are vital for alerting staff if a patient moves unexpectedly. This quick response can prevent falls or injuries. Non-skid slippers and mats are simple but effective tools to reduce slipping risks, especially in wet or slippery areas. Finally, wheelchairs and stretchers are equipped with safety locks. These locks are essential because they keep the wheelchair or stretcher stationary, preventing unwanted movement during transfers or while the patient is seated. Overall, these safety devices are all about creating a safer environment, reducing risks, and supporting our goal of providing the best care possible. This slide doesn't contain enough information. That's why we're moving to the next slide. Restraints in nursing are devices used to restrict a patient's movement to prevent harm. They can be physical, such as wrist, waist, mitts, or vest restraints, or chemical, which involve prescribed sedatives. The main purposes of restraints are to prevent falls, injuries to the patient or others, and to protect medical devices. When it comes to legal implications and consent, it's important to remember that a physician's order is always required before applying any restraint. Additionally, you need to obtain informed consent from the patient or their guardian, explaining why the restraint is necessary. Proper documentation is essential. Record the reason for restraint, how long it will be in place, and ongoing monitoring details. Application guidelines are critical for safe use. Proper placement of the restraint is key, and you should always check circulation regularly to ensure the restraint isn't too tight. It's also important to release and reposition restraints frequently, and continuous observation is necessary to ensure the patient's safety and comfort. Overall, restraints should always be used carefully, ethically, and in accordance with legal and institutional policies, always prioritizing the patient's dignity and well-being. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's talk about some other safety devices that can really make a difference in preventing accidents. First, bed rails, grab bars, and ambu alarms are essential for providing support and alerting staff if a patient tries to get out of bed unexpectedly. These tools help promote safety, especially for those who are at higher risk of falling. Next, nonskid footwear and floor mats are simple but highly effective. They help prevent slips and falls by providing better traction on wet or smooth surfaces. Wheelchair and stretcher locks are also critical. They keep mobility devices stationary when needed, reducing the chance of accidental movement that could cause a fall. Protective padding for high-risk patients is another important safety measure. It can cushion impacts and prevent injuries if a patient moves suddenly or falls. Finally, visual cues and signage, such as wet floor signs or fall risk indicators, serve as important visual alerts. They inform both staff and patients of potential hazards, so everyone can stay alert and cautious. All of these safety devices work together to create a safer environment and align with our overall goal of preventing injuries and ensuring patient well-being. Now, let's wrap up with some key points. Safety really is essential in all healthcare settings. It's something we must prioritize every day. The physical environment, the devices we use, and our own vigilance as nurses all play a crucial role in preventing accidents. Small actions and careful monitoring can make a big difference. Falls and other hazards are often preventable, and that's where proper assessment and targeted interventions come in. By identifying risks early, we can put measures in place to keep our patients safe. When it comes to restraints, it's important to use them judiciously, only when absolutely necessary, and always with patient consent and continuous monitoring to ensure their safety and dignity. Finally, I want to emphasize that nurses are the primary advocates for patient safety. We have a vital role in creating a safe environment, advocating for our patients, and ensuring that safety protocols are followed. Remember, our vigilance and proactive approach are key to providing the safest care possible. So, as we wrap up this presentation, I want to highlight some key references that underpin everything we've discussed today. First, we have Einte Taviscius and Workman's Medical Surgical Nursing, which is a comprehensive resource that emphasizes interprofessional collaborative care, something essential for ensuring safe and effective patient outcomes. Then there's Potter and Perry's Fundamentals of Nursing, a foundational text that covers core nursing principles and practices that guide us daily. Hughes' Patient Safety and Quality, published by AHRQ, provides evidence-based strategies to improve safety standards across healthcare settings, reinforcing the importance of continuous quality improvement. Morse's work on preventing patient falls offers practical approaches to establishing fall intervention programs, which is a critical aspect of patient safety. Lastly, we have the CDC and WHO guidelines on hospital safety and infection prevention. These are global standards that help us maintain safe environments and prevent infections. All of these references connect back to our overall theme of providing safe, high-quality care. They serve as valuable resources for ongoing learning and implementation of best practices in nursing. Remember, staying informed and referencing authoritative sources like these is key to delivering the best possible care to our patients.